Good afternoon and welcome to the Special Superintendent's Webcast for August 4th, 2020. We have another full agenda for you today, and of course, a hard stop. I believe we have another governor's press conference today at 4. We have a special guest today. First Lady Brittany Bashir will be joining us momentarily for an update and a presentation about a great, exciting initiative called Coverings for Kids that will help us with adhering to the mandatory mask requirements. Before that, I'm going to turn it over to Tony Cons, KD Interim Director of Communications, for a communications update, and then she will introduce the First Lady when she gets on the webcast.
Okay, great. Thank you, Commissioner. I will go ahead and share my screen. Let me know when you all can see that.
See it?
Okay.
Is it Superintendent's
All right.
website? Yeah.
All right, sounds good. So, so first up, we have obviously the agenda. Going up, letting you know, as always, our homepage is where you can find all of our COVID-19 updates. I want to make sure that you are always aware that we are keeping that up to date 24/7. All of our reopening guidance, although we have not reissued any guidance documents this week, we are planning to release some guidance documents next week. Dr. Kelly Foster will be joining us towards the end of the webcast to share some updates on class size waivers and things like that towards the end. But once we have anything that is shared with reopening, will be on the green tab there. All of the guidance documents that you can find are linked in your PowerPoint. We update, as we always do, update this every week for you. And this is just the list of all of the guidance documents that we have provided thus far. And next week, in addition to the class size considerations, we also will be talking about library guidance documents. So I will check and see if the First Lady has joined us.
Hi, everybody.
Oh, she looks like she has. All right, let me go back. I'm not sure. Let me unshare my screen for a moment. I'm not seeing. Can you all hear me?
Yes.
Okay. Are we able to? Just making sure we're able to hear and see from the First Lady's office. And I can go ahead and share the, I can share the PowerPoint if we're ready to go.
Is everything, are we good?
Yeah, I just want to make sure she's on.
I'm here.
Okay, perfect. Yeah, so without further ado, I would like to introduce the First Lady of Kentucky, Brittany Bashir. She and Lieutenant Governor Jacqueline Coleman came to the Department of Education a few months ago while we were working on reopening guidance documents with an idea for communities to contribute to the masking campaign. And I will let her go ahead and tell you more about it.
Hey, thank you so much. Well, hi, thank you so much for letting me be here today. I first want to extend a huge thank you to all of you for the leadership that you've been demonstrating over these past several months. You always do, but COVID has definitely required us to face many uncertainties and challenges. So thank you truly for rising to the occasion and carefully working out all the plans for this upcoming school year under these unprecedented circumstances. And I know it's changing minute to minute, so thank you so much. Because I know keeping the health and safety of students, educators, and staff on the front lines is utmost importance to you. So right now we're seeing a rising number of COVID cases in our children. And as a parent, I especially know how frightening this feels. And I know that all of you and our teachers and faculty and staff are worried about safety precautions going forward. And I also know this is something that Andy and Lieutenant Governor Jacqueline Coleman discuss daily. And because of these concerns, it's more important than ever that we are proactive in preparing our schools for a safe return. And I know this is going to look so different in every single district. And the facial coverings are going to be one of the many new logistics that we all have to face when we return for in-person instruction, which is why that I am announcing today that I have teamed up with Lieutenant Governor Jacqueline Coleman to launch the Coverings for Kids initiative. It's a statewide campaign that will collect homemade or store-bought mask donations to provide to Kentucky schools for students, educators, and staff at no cost to the school districts. We're hoping these donations will ease some of the burdens that schools and families face when it comes to having enough PPE on hand. We want all students and staff to have access to masks if they should find themselves without one or need to replace theirs during the school day, which being around kids, we all know is a definite possibility. So we are hoping for donations that will include both child-sized coverings as well as adult for older students, teachers, and staff. I want you to know that we are really eager to help our schools prepare for a safe return and a transition that I know is going to look so much different than any other year. So while still giving your districts the flexibility to implement these donations, want you to know we want you to figure out what is most useful for your communities. So we recommend that you establish a central location for donation drop-offs, like your district office, but really anywhere that you decide is perfect. And from there, we want you to be able to distribute masks in the way that makes the most sense for your schools and your district. We know that some of your districts are already running mask collection drives, which is wonderful and amazing. And if you're already doing that, we just simply want to extend the reach of your call to action. My office and the Kentucky Department of Education will be distributing outreach packages with pre-drafted language and graphics that you can use to promote coverings for kids. We also will provide a donation intake sheet so you're able to track total masks collected. We've established a website, which if you can see on your screen right now, it's at the very bottom. And it's a place where everybody can go to find more information on the drive and to learn how to get involved. We will work with KDE to address any questions that you have about this initiative. And if KDE doesn't have an answer for you, please feel free to get in touch with my office and we'll make sure that we get you any answers that you need. So thank you. I appreciate you letting me jump on your call for a few minutes to announce coverings for kids, and know that we are with you all the way in trying to prepare for a safe and healthy return to school. Thank you so much.
Great. Thank you very much for that update, First Lady Beshear. And I'll go ahead and go back to that first slide that just has the logo. And as the First Lady's office, she mentioned, I will be sending out a packet for you that has a whole bunch of useful information for you to use in announcing this campaign to your communities and throughout your district. And we hope, certainly at the Kentucky Department of Education, as does the First Lady's office and the Governor's office and Lieutenant Governor's office, that this will be very helpful for you as we talk about the reopening of schools, even for school districts that are participating in straight NTI. We know that the goal obviously is to get our students back in schools, and with the need for masks, we feel like this is a great way for our communities to contribute and help out. And there's been a lot of people asking how, and we feel this will be a great way to help. So just to follow up, here's your next steps. You will be receiving, let me go back down here so you can jump around a little bit. This is in your packet. You will receive the outreach packet today in your email, and we will need your help in spreading the word. The packet will contain some social media posts, some logos, and some draft emails for outreach. The community will be asked to start donating the masks beginning a week from today, so August 11th. And again, as the First Lady had mentioned, this will be up to you how you would like to handle this. So any questions on, if you have questions for us or for how you would like to do that, please let us know on that. And then you can also tune into the governor's press conference today at 4 p.m. Eastern after this webcast, as she will be joining, I believe she will be joining him to talk about this initiative during the press conference as well. And that is all I have for updates, since I've already run through the rest of my slides. And I think we're going to switch our order up just a little bit for the rest of the webcast, because Dr. Connie White is only able to join us until 3 o'clock. So we are going to put Dr. White up with any updates from the Department of Public Health up next. Dr. White.
Thank you, Tony, and thank you, Commissioner. Appreciate y'all having us today. Dr. Besley is going to be jumping in a few minutes. She had another conflicting meeting too. I know one of the questions that I have received several emails about is asking about testing. And if you listen to the governor's webcast, his press conference yesterday, even though the Kroger testing that contract has stopped happening, and all of the Kroger testing is now being done in a little clinic, there are multiple different entities that are getting ready to set up. Some have started in the Louisville, the Northern Kentucky, and the Lexington area to be sure that people have as much testing as possible. I just got off of an hour-and-a-half call with the federal government agencies, and the hour-and-a-half call was all about testing, all about the supply chain, all about availability. So this is something that's continuing to be discussed. We're working as many angles as we can to try to find more testing, because I know that your faculty and staff are very interested in this. I don't know how many, if anyone is requiring testing, but we want to try to see if we can help the healthcare community offer that testing. So I just didn't want you guys to hear that the Kroger testing was gone away and there's nothing out there now. So all that infrastructure is still being worked on to be sure that as much as the state can, we'll be able to provide that kind of testing for people. That was the newest thing. There also has been a great deal of discussion about plexiglass dividers. I've gotten a lot of emails about that. I've gotten a lot of emails that are using plastic shower curtains. When we're talking plexiglass, we're talking plexiglass. Any other types of plastic, I think the state fire marshal, they made it very clear when they talked to Kay Kennedy and Robin Kenny and our team here at DPH that those things are flammable, and there's no way that will pass muster. If you're going to use barriers, it would need to be some type of securely attached plexiglass to whatever barrier it's being attached to. So I just wanted to clear that question up so that everybody would understand that shower curtains are not protection that's safe in a school setting. And then I believe that Becky Gillis discussed last time, or on one of our calls, about we at DPH felt like that the safety of children as far as securing doors was very important, and that as much as doors could be open to increase the ventilation, that was important. But we certainly know that you folks know much better than we do the importance of when and where doors can be open or not. So we are leaving that to you to be as flexible as you can, but certainly not to place any students, faculty, or staff in any danger. So those were the three areas I wanted to be sure that we covered today, Commissioner Brown, and as always, I'm certainly happy to answer questions that you might have.
Tony, while we have Dr. White with us, can you go to the soapbox to see if there are any questions pertinent to DPH, and then we can address those now?
Sure. And I also wanted to draw your attention to the slide that's on the up right now, because we did make the addition to the Healthy at School guidance that we had talked about last week. It is a one-page in the beginning of the booklet. It's actually in page 6. So when you go, you have to look at the booklet that we have provided on the website, and this gives you where the updates are. So again, it was revised on the 28th, and so that was the one page that was sent out to everyone. But that's what it looks like on in the actual document, and we are working on getting that translated. So, so with that being said, we will stop sharing and go to the soapbox.
And I'd like, while you're looking, Tony, I'd love to be able to send some of this information about covering for kids to our local health departments, our nurse leaders in the local health departments, because I'm sure they would love to be a part of encouraging this initiative, so that schools are sure that they have what they need for these kids, because some of those kids will not have what they need. Or as the First Lady said, some will come with a clean mask, and it won't be long before that will be a clean mask.
Okay, so our first question is going to be in relation to field trips. We have a question that says, page 7 of Healthy at Schools document says cancel field trips and other large group activities. How are we able to have athletic events based on this guidance?
Well, Commissioner Tackett is available. Maybe I'll punt that one to him, because I think I do know that what we're trying to do is to try to discourage as much travel as possible. And I know that their travel for the athletics is very circumscribed. So am I allowed as a guest to call in another guest? Is that allowed, Commissioner Brown?
I think at this point, you're no longer a guest, so.
Well, thank you, Dr. White. Real quickly, if you don't mind, Kevin. Early on in this process, extracurriculars were separated. And that's why you went through several weeks ago with the music educators. They had to get plans approved. Anything for athletics is going to have to be approved through the state, through both Kentucky Board of Education and the Department of Public Health. So it is not really wrapped into the instructional day guidance. But we are having to go through a lot of hoops, and whatever is approved when it's submitted to public health on or around August 10th, we'll be glad to share and be able to give some pretty precise details. They've not been viewed all along in this process as the same thing.
Okay. So I think you would look at what you're planning on doing. If you want to take 150 of your choral group on a Trailways bus to Washington, D.C. to sing at Washington Cathedral, that won't be happening, from what I understand, if I'm correct on that. But if you have a group that you want to take to the Speed Museum in Louisville to view an art exhibit, and as with the athletics, you're not carpooling, and people want to go and they wear masks, and I'm sure and I know the museums have their guidelines as to how you can socially distance and view works of art, then I would see that would be a reasonable request to your superintendents, and then you would make decisions and make sure it follows the Healthy at School guidelines. Does that sound in line with your thinking, Commissioner Brown?
Yes, and I think the question is, asking why does it appear that it can do one, meaning athletics, but not the other? And I think the answer is that we're going to be able to do a little bit of all of it probably, but it's going to be very limited, and it's not going to look like it was at the beginning of last year. And just in your example, Dr. White, I think was perfect. And then, of course, we know as we get on into the school year, and we certainly hope as we get on into the school year that we are all resuming getting back to in-person instruction as much as possible, and then we can update the guidance as necessary as the virus hopefully continues to, the cases to continue to decrease. We will obviously be paying attention to updating that guidance and hopefully removing some of those restrictions as we get on into the school year.
So I would say that there are things that can be done. I like what Commissioner Brown said. They are not going to look like what they would have looked like last year. But I think if we're creative and innovative, we can find ways to give our students a reward, those extracurricular events that they have missed and look forward to, but it's going to be done in a very different way in smaller groups, in just and the whole look and the whole vibe about it's going to be different, but to give them those educational opportunities that we all thrived on as we were learning.
All right. Our next question about health, it's about ventilation. If a resource room has poor ventilation, is there a recommendation for an air filtration system?
I think that might be, again, a Kay Kennedy question because she knows more about ventilation than I do, but I think we all agree that is any opportunity you have to open doors, and even if there's a window that's allowed to be opened. Someone asked me if they should break the windows open. No, when I say open a window, I mean one that opens. Don't break it. But opening windows and doors as much as possible is going to help. And as far as vents and HVAC, that's a little bit out of my league. Kay, do you have any comments about that?
Yes, this is Kay Kennedy. If you have a room that you want to improve the filtration, there's a couple of things that need to be taken into consideration. One is the size of the room, and then the degree that you want to turn over the air in that room. I think if you check the CDC website for office type setting or improving ventilation, they would recommend units with a HEPA filter. But again, you have to make sure that you get a right sized unit and that it is a unit that you are able to maintain in terms of changing the filter or maintaining the filter according to manufacturer specifications. And again, you have to be careful that your electrical circuits can handle additional load in that room. So to the extent that you may want to consult with a professional in terms of air quality, that would certainly be in line as well. So if you have a specific question, you want to drop me an email, we can try to be more specific in terms of an answer.
Okay, sounds good. Next question, and this is kind of in relations to that question, which is at the top of the soapbox. In relation to ventilation, they were looking at ionization equipment for these rooms, and it's not in reference to the open doors or for safety. So I'm just crossing that one off, just so that people know that we are addressing that question. And if you have questions, that Kay Kennedy can be in touch with you on that. The next question
Tony, before
is
you
going
go on,
to.
I just received a comment from a superintendent. You know, this ventilation issue is multifaceted in that while there's a need for ventilation, obviously due to the virus, then there's also other issues that can come up when you're talking with, as superintendents have been doing, talking with their HVAC engineers and consultants, that then we can have an increase in humidity levels. Most of our systems are designed to be running without windows open, but then when windows open, you have a lot of humidity that can also cause other issues, mold, etc. So it's a very complex issue, and it's going to be something that we're going to have to continue to evaluate as we move forward and as we continue to work with experts in this area. And obviously, something our building systems, many of them are built to not really have windows open. So we're going to have to monitor that closely and take into consideration the public health aspect, but also maybe unintended consequences. So our folks will continue to be looking into this, as well as with public health and other experts in state government.
Okay. The kind of as a follow-up to the shower curtains, they said that the fire marshal sent an email last week eliminating the use of any material to use as dividers that are flammable or are made of toxic fumes. what can be used?
Well, in the chat box, there's mention of medical supply companies that have non-flammable curtains, and that's from Angie and McDonald, and she knows more about that than I do. So that would be something you might could look into. But I think for what we had been talking about dividers was plexiglass. That was initially we had said no to plexiglass, and after some conversation and looking and talking to the fire marshal and doing some different digging, we decided that that was an extra layer of protection for the students to use, but with a clear understanding from the fire marshal of what was and wasn't allowed. And they're concerned of anything that does catch fire that could have toxic fumes. It could be that was my background. Before I went to medical school, I was a toxicologist. So you certainly don't want something in your school that you know the minute it sets fire, it's going to send out toxic fumes that may even be more harmful than smoke would be. So I would say that would be something you will obviously talk to your KDE and environmental folks and with Kay Kidney and her team, but also check with your fire marshal so that you don't purchase something and then find out you can't use it. You certainly don't want to do that. That's definitely an unintended consequence that we don't want you to have.
This is Kay. I've seen a lot of homemade solutions on social media for creating dividers. And as Dr. White mentioned, you do have to be cognizant of toxic fumes should, maybe not even a fire, but something just smolder, the toxic fume. The other thing you have to be careful about is having free egress from a room or a building. And if you put additional barriers of any kind in a building, you don't want to negatively impact the ability to evacuate a space safely. So my recommendation is that if you are considering some additional barriers, to check the fire rating of that particular material, but also maybe just check with your local fire marshal about any impacts to the ability to evacuate a space in the event of an emergency.
Okay. Great. Here's another question relating to health. What advice do you have for districts when teachers get mask exemptions, especially if they work with preschool age students?
Well, the mask exemption, that places the teacher that has the exemption at risk, and it places others at risk as well if that teacher happens to be an asymptomatic spreader. However, obviously, if someone has COPD or some type of medical issue that they will hinder their breathing, that would be a barrier for their breathing, we don't want them to do that as well. I know we've talked quite a bit about face shields, and some people had said that they thought that face shields could be an option for people who can't wear masks, and I'm not opposed to that at all. I think that would certainly be better than nothing. It would provide some protection, but certainly not the same amount as a face shield, as a face mask or a face covering would. Your concern, and it's quite founded, if we said that only first grade and up are required to wear masks in the school setting, then all of these preschoolers are going to not have masks on. And I did have communication from a kindergarten teacher who was very adamant that she felt uncomfortable if her kindergartners did not wear a mask. I'm not opposed to kindergartners wear a mask if you've got a teacher and a leader who can work with them and get them to be compliant with that. So I think the more layers you put on, the safer you are, and the more layers you take off, you do expose to some risk. So I'm not sure what the question is, other than I agree with that, whoever sent the comment in, that when you take that layer of protection of a mask away from the teacher and then the children don't have that, they are interacting and breathing the same air, and if there is a case, it will spread rather quickly in that classroom.
Okay. All right, thank you for that one. The next question, if staff is told to stay at home if they have symptoms, what should we require to know if it is a sick day or an emergency day so that this is not abused?
Is that a commissioner call?
Todd Allen may want to come on. There's a flow chart we created using the guidance from the various leave provisions that may be able to assist superintendents in that answer. And Todd, do you want to comment on that, and maybe Kelly Foster?
Yes, Commissioner, I agree that I think that flow chart that we have provided, as well as the guidance that we have provided out around the various leave options that exist, may be helpful for school districts when making this determination. When looking at sick leave, if a school employee is looking to use sick leave under the Families First Coronavirus Response Act, I would encourage school districts to look at the provisions in that act for the use of leave, and those are detailed in the guidance that we have provided. If a school district employee is looking to use their accumulated district leave that they have during typical operations, I would encourage superintendents to look at school board policy. All of you all already have policies in place that spell out the criteria for use of district sick leave. And finally, with regard to emergency leave, the State Board of Education is expected to adopt an emergency administrative regulation at its meeting on Thursday, I believe, to provide school districts the flexibility to grant additional emergency leave to both part-time and full-time employees. If school districts elect to do that and provide additional emergency leave, they also must set forth the procedures that they will utilize to determine that that leave is related to COVID-19. So that is going to be left to school districts to determine, just as it was whenever they implemented Senate Bill 177 that provided school districts with that very similar flexibility.
Okay. All right. The next question is, there's another question, a lot of concern about the ventilation. I just want to make sure that they know that we're addressing, there's concern over their small windowless 50-year-old high school classrooms. So just concerned about the virus being spread through ventilation systems. So someone just to provide HEPA on air filters guidance. So I'm going to mark that one with Kay Kennedy, and we'll get that back. We'll get back to you on that one.
This is going to be a very hot topic for the next probably several years, ventilation. And my guess is if KSBA has an in-person convention this year in February, they better get extra space for the vendors, because we all know that and I'm not encouraging districts to go out and buy anything, but we know this is going to be a huge issue. Obviously sanitation, HVAC, issues about turning air over that we've really never thought of before, just because of we were thinking about it in other ways, not necessarily about a virus. So be prepared to be approached, superintendents, by vendors, and some of those may be options you need to consider and others may not be, but our facilities folks are already looking at these issues and then working with public health and others. This will be an evolving topic.
Okay. The next question is next question on health. Getting through. All right. So we'll go through some of the. So question, respectfully, if the Kentucky Department of Education and the governor are making, quote, recommendations, I assume we can follow them or not.
Yes, the governor has prided himself, and I've also taken pride in the fact that in Kentucky we have been able to have all of our schools closed within 48 hours initially back in March, have all of our school systems based upon a recommendation go to completely NTI to finish out the year and to fulfill the full year using NTI. We're proud of that because we didn't have to resort to an order to do that, because as I've stated before, and I don't just say this to be cute, I believe it, we are an education family and we operate as a family. Operating as a family doesn't mean you like each other or that you agree all the time either. It means you have healthy debate. But at the end of the day, we're here to take care of kids, and we're Kentuckians, and we're proud of the education system, and we're going to do what it takes as a team. And that's what's happened to date. But yes, it is a recommendation. So if you want to go against the governor's recommendation, which was based upon feedback from the White House Centers for Disease Control, the Kentucky Department of Education, and the Kentucky Department of Public Health, and others, then you and your board can do so. But you better be prepared to reap the consequences if you're going against all of that guidance and feedback.
Okay. The next
When I say
question.
consequences, I'm not talking about a heavy hand from state government. I'm talking about what could happen in the public health sector. What could happen because we are making these recommendations based upon an uptick in case, not even an uptick, a spike in some cases, a spike in cases, a positivity rate above 5%. Luckily, we're seeing some signs that that's going down. Community spread, because things that are out of your control in school districts, because we still have community members going to Florida, going to Texas, going to the beaches, because we still have things on social media going on that are showing that people are not practicing social distancing. That's why the recommendation was made, to give us more time so that the mitigation efforts that are being followed will have time to take effect. The mandatory masking, the closing of bars and those other things, reduction of restaurant capacity. And we're cautiously optimistic, if you watched the governor's press conference yesterday, that we are seeing that go in the right direction, but it's still obviously a little too early to tell. And so that's what this 2-week period is about, getting us to hopefully August 15th to see where these numbers will go. That recommendation is based upon that working. But if a district chooses to go another direction, you probably will get a call from myself and the governor asking you to rethink that decision. But at this point, it is a recommendation.
Okay. The next question that we have is, can we have a comprehensive list of all the quote shall regulations from KDE instead of the quote expectations? Question mark.
The expectations are those expectations developed in consultation with the Department for Public Health and other state agencies on how you can conduct school operations while reducing the risk of transmission of COVID. If you want to call them requirements, you can call them whatever you want. They are expectations. If a district is saying we're just not going to follow these expectations, then you're going to have follow-up from KDE and others. And you're probably going to see an increase in cases in your community because those expectations are designed to mitigate the spread. So if you'll look at what we're calling the flagship document, that document is divided into expectations and best practices. Expectations, I believe, if I remember it correctly, are in kind of a one shaded area, and then you have another box on another page talking about best practices. So they're already listed for you. If you think we're being cute by saying they're expectations when they're requirements, and you want to mark out expectations and say requirements, that's fine with me. But we did that because, again, getting back to the fact that I think we're all trying to row in the same direction here. We're utilizing expertise at the state and federal level to develop these expectations. And we want them also, though, honor local control, because there are many things that are still under your authority on how to implement those expectations. You've got 3 different ways to take temperatures and how you can do that to best meet your needs. There are a lot of flexibilities built in due to feedback from this very webcast that's occurred every week. So we're trying to balance that of state and federal level expertise that we can provide and give some state level expectations while also honoring local control. And that's how we've conducted this this entire time.
Thank you, Commissioner. The next question, I think, is if we have a county rate above 5%, and I'm guessing that's positivity rate, is it recommended to start virtually?
Well, at this time, and there have been conversations both with KDE, we've had them with Commissioner Brown and the Lieutenant Governor and incoming Commissioner Glass to talk about finding that metric. And I know we've talked about this maybe the last 3 weeks that we've had this session. But right now, we don't feel that there's a clean enough metric. And when I say clean, in the data world, before we give you a piece of data, we want to make sure that it's very well validated. And we are concerned that if a certain county has a certain positivity rate, but you've got faculty and staff coming from other counties who might have a much higher positivity rate, that county positivity rate really means nothing as long as your boundaries are open. So giving you one metric, one bar, one hurdle does not really reflect what's happening in your school. You could also use attendance rate. You could also use a whole host of other numbers. You could use hospitalization. How many ICU beds do you have? You could take all of it and glob it all together into a metric. But as long as there's fluidity of your borders and you've got students and staff and faculty coming and going, and most of our counties are small counties and we're dealing with very small numbers, just one more case rate could be enough to sway your positivity rate in a way that we would not feel is significant because the numbers are so small. That's why when we give numbers, we give them for the state because we want to make sure that these are valid numbers. We really don't feel like there's a number like that we can give you that we can hang your hat on and determine whether school could be open or not. We're not completely close to that idea. Incoming Commissioner Glass gave me a couple of references to look at, and we're looking at that. We've talked about different ways that we could take our data to try to offer something that could assist superintendents, but I don't think there's going to be something that's going to be the ironclad. If you get here, you're okay, but if you get here, you're not okay. We haven't come up with anything that we can validate that we think would give you the right advice at this point.
Okay. The next question that we have is, let's see here, we're going to go keeping to health. Okay, why are we basically getting the same information week after week? Latest guidance document is dated June of 2020, no change. So I can start this off if you would prefer, because I will go ahead and share my screen. As I shared at the beginning of the webcast, the Department of Education has been providing guidance documents for all of our districts and our superintendents since the beginning of May, actually middle of May. I think we're at number 18 or 19. Dr. Foster can probably correct me on that. We have 2 more guidance documents that will be released next week. I am going to share with you my screen so that you know how to access these. I know that you are all getting the emails and such, but I know that you're busy and I know you're trying to make a lot of plans. So can you let me know when you see my screen?
Yes, we can see it, Tony.
Okay, so this is our KDE's homepage. You just go to the KDE homepage and you click on the KDE COVID-19 webpage, which is loading now. As you can see, we have all sorts of information here for our school districts and superintendents. But the page I would like to draw your attention to is the KDE reopening guidance tab. So you can click on that green guidance tab. And not only do you have the PPE equipment supplies suggestions that we have added, we have all of the reopening guidance that we have issued, as you can see, as recently as July 27th on food service options and flexibility for assigning staff, all the way down to our first guidance document, which was issued on May 15th. So if you have any questions or want to refer back to any of the guidance documents that we have issued as a department, or even going back to the Healthy at Schools document that we have translated into 6 different languages aside from English, or the safety expectations posters, they're all here on this website, on the KDE website that we have created for you for your use. So and then we also, as stated earlier in the webcast, we did update the 1-pager for the Healthy at School document just this Monday. So the PowerPoint is attached to your invite, and all of that information, all the links to all these guidance documents are provided for you in that PowerPoint. If you have any more questions, if there's anything I can help you with, if we can communicate with you any better, please let me know. I'd be more than happy to reach out. Commissioner Brown, did you have anything you'd like to add to that question?
I would just say, and Tony, that's a great summary. This guidance is evolving, as evidenced by the an update on the KDE guidance document on class size that you'll hear Dr. Foster talk about a little bit later. You've heard about the changes to the flagship document on, I believe it's, I don't want to say the page, but there's a page on there where there's about 1 page worth of changes based upon
Page 6.
Page 6
Page
in the
6, I
flagship
can go to
document. That's based on evolving feedback from superintendents and the evolving nature of the virus. I've heard complaints we have too many guidance documents. Now I'm hearing complaints we don't have enough. Probably tells me we've got enough. If you've been following the guidance documents, or at least, and I know you're overwhelmed as a superintendent, but trying to farm those out to your staff, and you have been putting a plan in place using community members and your teams, communicating with your building principals, and you have your playbook ready to pivot to hybrid, to pivot to NTI, to pivot back over to going in person, then you've done exactly what we've been talking about since May 15th. And now is the time. We're kind of in a holding pattern right now. We're waiting for the tower to tell us whether or not we can take off with what we really want to do, which is get back to in-person classes. But we know right now it's a little bit too dangerous to do that because of the data we're getting and the nature of the virus. And that's why we're in this holding pattern until August the 17th. And the governor's office, Department of Public Health, working with the department, will be reevaluating that as we continue to get more data in. So what I'm saying is we have as much, if not more, guidance to you than I would put up against any other state. We did it in a way to be gradual so that you could more easily digest it over the summer and implement it as issues came up. And that's how we've been doing that. Now, if there are changes, you can bet that the guidance documents will be edited, and we will tell you where those are edited, and we'll come back on this webcast and tell you what has changed, just as in page 6 on the flagship document.
Which is now on your screens that you can see, which I got to by going to our KDE COVID-19 website. So again, if there's any way that we can communicate with you any better, please reach out to me or the commissioner or anybody on the leadership staff, and we'll be more than happy to figure out a better way to get these communication updates to you.
Tony, this is Kelly. I'll just add, to date, we have released 17 guidance documents, and I'm thinking that must be a typo because, you know, our most recent document was last Monday, July the 27th. And I'll be talking about some upcoming guidance coming up later on in the webcast. But, you know, just like you showed, we've been releasing guidance every single week. And the last guidance that was released was July the 27th.
And I apologize because I think some of you have listened to every single Tuesday afternoon, and so you've heard me talk and answer the same question several times. But I think some of you are coming and going, and sometimes you're at the webinar and like somebody just walked in my office and interrupted me for a second. And so those things happen. So sometimes we do have to answer questions more than once to be sure that people are completely clear of what's being said. And if we're saying something that's not appropriate, then that's why we regroup and meet every Thursday with Robin Kinney and Kay in the group and try to hash these things out. So I appreciate y'all hanging in there with me.
Okay. And I've got another question. Also, I wanted to bring up too, you know, the FAQ sheets that we have that are available, those have been updated. We call it the yellow sheet, the green sheet actually, and that is also available on the KDE website on the COVID site. There are over, I think, 500 questions on there that you can easily search. All of those questions have been reviewed by our legal staff and my communications staff. And those are all questions that have been asked during webcasts and advisory council meetings, the town hall. We have put all of the questions into one document so that you can go at any time, whether it's 2 o'clock in the morning or 2 o'clock in the afternoon, and you can look and see answers to questions that we have already provided answers to. And we will continue to update that document throughout this pandemic for you. This is something that we're trying to do. Again, we're trying different ways to provide help and support to you as you are making these difficult choices for your districts. There is a couple more health questions I wanted to get in before Dr. White had to leave us. Do we know, will we have metrics down to the county or regional area to determine safety to have in-person school down to the county or regional level by health department region?
And I think I just answered that one earlier when the question was about the metrics. We can give numbers, we have numbers, but do those numbers really mean or reflect anything? It depends on the size of the county, it depends on the quality of the reporting, and do those numbers really tell you whether it's safe or not? And we don't feel like that is the case at this point, but we continue to look at that and to continue to try to evaluate and continue to work with other departments of health across the country. Is if they've come up with something, we are very happy to borrow shamelessly, as we say in public health, from any other state that is doing something that they feel like and they can show that it would be a meaningful way to assist you in those decisions.
Okay. Let's see. When can we expect more reopening guidance regarding those positivity rates, as discussed by Dr. White?
I think I just tried to answer that. We can look at numbers, but what do they mean on a small scale versus a statewide scale? And that just isn't really clearly available and clearly meaningful yet.
Okay. I do have a question on the Google slide that was sent in separate from the soapbox about the positivity numbers in Indiana and reporting with the school districts in Indiana that are reporting the positivity numbers among staff and how that's going to be reported. Does the Department of Health have is there any input as to how that's going to impact what could happen in Kentucky?
Are you talking about positivity rates among school staff and faculty?
And students that have, they've reported back to school and they're wondering what methods that might have or what impact that might have on the reporting numbers for Kentucky when school resumes in-person classes.
Are we expecting the numbers to go up? I would say the more you're interacting, the more chance of numbers going up. The more people, like we're getting ready this week, we're testing 30,000. We aren't. UK is testing 30,000 students coming back. They're going to have an increase in numbers. Fayette County's numbers will go up. We expect that. And are we going to try to segregate that out as reporting? That's not something that's come to mind since school hasn't opened yet. But that's certainly something we can entertain to see if school districts want to have that kind of reporting. I'm not sure, but that's a great idea, and it's something that I can entertain with our epidemiology team.
Okay. This next question is going to be for Kevin, since it relates to KDE. It is very difficult to promote reopening schools when KDE isn't modeling healthy at work.
I think that's a comment, not a question, but I'm happy to discuss that. I do believe KDE is modeling healthy at work. If you've heard the governor in recent days, he talked about how healthy at work also includes employers, supervisors, and managers always looking for ways to see how their employees can do their jobs in a remote way or in a way that does not put them in a situation where they're on top of each other in a normal environment. And that's what we are doing, and that's what we encourage you to do. And we encourage you to continue to look for ways for telework for your central office employees, for teachers that may be immunocompromised, or for other reasons that can teach any of your virtual classes. You all are already doing that, and we're hearing reports of that. So I actually disagree with the comment. We are modeling healthy at work. We have had a soft opening to the KDE Sauer building and on July 15th and have employees returning to work. But right now we're in a situation where the governor and the public health experts have recommended that we not go back to in-person classes. So sitting here right now where I am is modeling healthy at work, as are the other employees that are working from home. Now, you can't make a Toyota car from home, and you can't educate kids in person from home We understand that. And so there are going to be some trade-offs, and there are people that will have to go into work. And I believe the department, and that will be under Dr. Glass's decision, but the department will eventually scale back up to being in person, just as your central offices will and your schools will. But when you have one person that is able to fully complete their job duties by teleworking, you are protecting the others that have to go into a certain area to do their job that don't have that choice. And that was some of the initial concepts we talked about early on in the pandemic, that when you reduce the building load or the building capacity of employees, even by one or two people that might normally be there, you're automatically increasing social distancing, and that helps. And when we're seeing an uptick in cases, or at least as we have over the last few weeks, and community spread, and people continuing to go to the beaches and continuing not to practice social distancing, then we need to be cautious, and to the ability to the if we have the ability, then we need to utilize teleworking wherever possible.
All right, thank you. There is another question that was just submitted. If numbers are expected to, let's see, they added an adjusted comment. If numbers are expected to increase due to interactions, then is it likely that our teachers and staff have greater risk of contracting COVID, meaning that if they end up going back in person, even if the cases plateau?
I think what I was talking about is as people come back, that it's like my example was at UK, where we're going to find people that are going to be coming into the school setting that once they check and find that they are positive, they can keep them from going into that school setting and affecting others if they put them into isolation. So we've talked about before that the way to not get COVID-19 is to stay at home in a bubble. That is not practical. That's not mentally healthy. That's not financially healthy. We have to live, to quote President Capilouto, we have to learn how to live in a COVID world. And the public health tools that we've tried to put into the flagship document and that we've talked about weekly is if you do your masking, if you do your social distancing, if you do your hand hygiene, then is there a chance you could get COVID as opposed to staying home in a bubble? Yes, there is. But that also means that you will be able to, in a safe way, present yourself in a school setting. It's up to the individual to decide the level of risk that they want to take. I come to work every single day. I have every day since March the 6th. I've come in on weekends. I wear my mask. I don't get up from you are the only people that see me without my mask on, because if I'm not Zooming, I have my mask on. So I am choosing to take the risk to come to work because I feel my work is important and meaningful, but I am using smart, sensible, basic public health tools to keep and protect me and my husband, because both of us are at high risk because of some personal health information. So I think it's a choice that everybody must make, but I think I gave the example last week about the two hairdressers that were both symptomatic with COVID, decided to go back to work. They saw 156 clients between the two of them. Every client wore a mask. Both of the hairdressers wore masks, and none of their clients were infected with COVID-19 over that process. So I think using those public health tools are a way that we're going to help to protect not only ourselves, our families, but others around us. So that's the only answer that I can give you.
Okay. All right, Dr. White, I know it is 3:01, and I know you have to get off the call, so we appreciate your time as always, and your commitment. You have been with us since the beginning and helping us answer the questions for the superintendents. I know Dr. Meserly is on as well.
Yes.
Great. And so we will, I know there'll be more questions that'll be submitted for the next hour, but I just wanted to acknowledge and appreciate your help with getting these questions answered at the beginning of the hour versus the end while you were here.
Thank you for accommodating me. I appreciate being here. Thanks a lot. Dr. Meserly can fill in while I'm gone. Thank you.
Okay.
Bye-bye.
And then goodbye. Commissioner, you wanted to chat before we go over
Yes,
to
before we
Julian
get
Tackett?
to Commissioner Tackett, and first of all, I just wanted to thank all the superintendents and others for these questions. I think that some of the questions are showing there's a lot of anxiety out there, and there is anxiety. There's anxiety everywhere at the department and in school districts, certainly, because you all are there on the front lines. I know you're getting a lot of questions from constituents and that are difficult to answer, even more difficult than the normal questions you get when you're out in the community. So I want you to understand that we understand what you're going through, and that this is a very difficult time. And even though the answer for your district and how you go back to school is not necessarily going to be the same answer for your neighboring district, and that just automatically, I think, causes anxiety in communities. So you all are doing a good job. I want you all to hang in there. This is what this webcast is for, is to have these questions. And so I want to thank you all for that discussion. But I have a surprise guest for us. Tony, you don't even know about this. We're pleased to have Dr. Glass with us today watching the webcast, and he's going to be able to say a few words. Dr. Glass?
Thanks, Kevin. Great to see everybody. Can you hear me okay?
We can, and we can see you, and it looks like you are in your office.
I am, and I can confirm that the Kentucky Department of Education is having safe practices. I had to be temperature checked coming in the building. There's very few people here. Looks like about 5% of the staff is present, and those that are in common areas are using masks, which is what should be happening. I have had the chance to listen into the conversation so far, and it reflects honestly the same conversations that we're having in Colorado and that my colleagues and peers across the country are having as we struggle with what's the right thing to do with reopening. We've got medical and scientific information that we're trying to make sense of. It changes every day. Just this weekend, we saw 2 studies come out, one from the CDC and one from the Journal of the American Medical Association, that reversed what we thought was previous thinking around infection rates and transmission rates for children. We've been I think superintendents across the country had been operating under the assumption that children under 10, in some cases under 17, had less transmission, less adverse effects, and lesser infection rates than adults. We have 2 studies that came out this weekend that points in the opposite direction, one of which indicated that it's children may be more infectious than adults. So these are troubling. So the information keeps shifting underneath us. And not only do we have medical and scientific information that we have to process through, there are also instructional and workforce issues that we have to consider. And we're not honest if we don't say that there are political issues that we have to consider and authority issues. I saw this story that just came out about superintendent in Jessamine County going against the Board of Education. So that's clearly a political issue that's at play in that community that I'm sure at play all across the state. And as we have variability from one community to the next, that creates greater political pressure on superintendents. And we're all wondering what is the right answer. And I think the honest truth is we're going to be in this uncomfortable place all the way up into the start of school where we're trying to figure out what the right thing to do is, because there is no consensus on what that is, either from the medical community or the educational community or within our families and larger communities that we work in. So these are really difficult times. I think Superintendent Kalk in Fayette County said it best: there is no plan that is truly final at this point. We all have to keep learning, keep adapting, and be ready to shift as conditions move. I also heard some of the conversations around these metrics, and I think that's an effort to find some kind of objective criteria by which we can make the decision, which would be really helpful. If you had just had some dashboard or color bar that when the lights changed, you knew what to do. That's difficult. Those are difficult to put in place for the reasons that were stated here. You have a bunch of different variables you have to take into account and include infection rates in your community, infection rates in surrounding communities, what's the hospitalization or number of hospital beds that you have and ventilators that are available. These are things that none of us as superintendents have processed through entirely, and nor were any of us trained on how to manage these sorts of issues. So we're having to learn as we go to and rely on lots of feedback. I know that there are some of you that would wish that the department or the governor would just come out and tell you what to do, and then the other half of you reject that sort of reach from the state at the same time. So I know that both the department and the governor and all the superintendents and school boards in the state are in a really difficult situation. And please know that I'm in that same situation too, trying to figure out what the right thing to do is for my district in Colorado. But I did just want to say hi and listen in and try to get up to speed. Kevin's been fantastic about continuing to work with me and make sure that I'm aware of the things that are happening in the state, the concerns of the state, so that when I officially begin as commissioner here in Kentucky, I'm up to speed and I'm able to support you effectively, beginning right on the very first day on the job. I think you've been in very capable hands. I would agree with the statement that was made that Kentucky's guidance around this has been superior to what we've seen in several other states, including in Colorado. The frequency of it and the quality of it in Kentucky just has been really good, but I know that it's not giving you what some of you, I think, want, which is a clear direction, or to say clearly, here's what you should do. And I don't think that's honestly going to be on the way. So we're going to have to keep learning, keep gathering information, and making the best decisions that we can. Tony and Kevin, I'll stop there. I just wanted to pop in and say hi and keep listening in and keep learning. But I'm happy to take any questions if there is time, or if you prefer to move right along to the next item on the agenda. I understand that too. But just a pleasure to be with all of you this afternoon.
Tony, I think you're muted.
Of course I'm muted, so I appreciate that. Thank you very much. There's a couple of more questions that I think we can get to towards the end. I'd like to maybe go to Julian. Let me see here. There's some questions about emergency leave. I guess, Kevin, if you want to just kind of let me know how you want to proceed.
Unless there are any specific questions for Dr. Glass, then let's move on to Julian, then we'll do all the questions at the end. And I just want to again thank Dr. Glass. And Dr. Glass has already started before he's required to start. And that's just a testament to his dedication and excitement about being in Kentucky. So I want to thank him for that. The transition is already going very well. And,
Great.
And that's due to his interest and excitement in being here. So I want to thank him.
And if you guys have questions for Dr. Glass, as he indicated, he will be listening in. So if you want to put those on the soapbox related to COVID or whatnot, we will try to get to those by the end of the webcast. So, all right, I will go ahead and just share my screen. It's just one little PowerPoint presentation here. Without further ado, I would like to introduce Julian Tackett, who is going to give you just a couple of updates, because there's just been a few since we last spoke and brought Julian on from KHSAA. Julian?
Thanks, Tommy. Can you hear me okay?
I can.
I always want to be sure that I'm not muted. Real quickly, in deference to your schedule, and we can do another opportunity once we finally get approved guidance from the state through the Department of Health, we'll be able to answer a lot more questions. But we've sent out some information to you in the last couple of days that you have not had time to read as superintendents. I understand that. We've sent it to everything we're sending out. I've asked that we send it to the principal, athletic director, and the superintendent. We want to keep you in the loop rather than just going through our ADs like we might do on other issues. We really want to get it to all levels. The board has decided, and remember, they are represented by you. We have 9 superintendents out of the 21 people that were in the last meeting that they talked about. They very much listened to your input and feedback. I can tell you that right now there's deep concern about some of the states that we think frankly have moved a little bit quickly. They've canceled or moved things. And while that may sound like the easy route, they're already seeing problems with students withdrawing and going to states that are playing. They're seeing lots of transfer issues. They're also seeing the issues of students congregating, congregating with other levels of play, perhaps third-party outside teams, et cetera, that are not education-based and don't have the best interest of the kids. So one of the things that we have been able to do all along is kind of watch what's going on in other places. But the board pretty much reaffirmed that they want to try to start, but they did push back practice, really, to your all's benefit, almost 5 weeks in sports. Yes, there's been some informal things going on around campuses. If you all chose and your health department chose to allow them, we feel like when you look at potentially 18 sports in 280 schools, we've had very few incidents, and we have no documented incidents where virus transmission occurred at a competition practice, official practice. Yes, we had a very much ballyhooed weight room incident that was mentioned at one of our schools. It has an extremely old facility, and there were some issues, people coming back from vacation, as Kevin said earlier. There were a variety of reasons maybe behind that, but we continue to work toward a start of practice on August the 24th with a goal of trying to play some type of competition September 7th. When I first made a recommendation to the board about scheduling this summer, one of the things I really tried to push was, could we get out of the way of your start of school, regardless of how you're starting? You've got a lot of information that's been sent to you. I'll just I want to summarize 2 or 3 bullets, and that's it. Number one, we certainly know the value that it is to enrollment and student success to be playing athletics. So as we go forward, we're keeping that in mind. So that drives us a little bit to make sure that these opportunities are not lost unless that's the only option. If there's any other option, we're going to work to do it. We've been working pretty much around the clock since all of this started in March at a way to try to keep this boat level and not let it get down in the water. So we will come out. We have our deadline for our board is to get a draft document of game guidance, which we will call Healthy at Sports, which I believe came as a suggestion from this meeting a few weeks ago. We will submit that document over to Public Health, let them take it apart, fix it. We will have sports-specific guidance in there, but a lot of stuff is about actually holding a game. What are we going to expect out of officials? What should they expect? What should you expect? I don't think you're going to see much different than you currently see in the guidance from KDE. There'll be cleaning requirements. There'll be space requirements. There'll be a variety of things. I think you can count on the fact early discussions with all the people in state governments, whether it's the Department of Education, whether it's public health, or whether it's the folks in the governor's office. I think you can expect attendance limitations. Where those land will be a product of trying to see what's going on other places and what public health is willing to let us try. And then what we also maybe need to let you try to decide. Are there some local factors at play here that can help? Do you have a stadium, for example, where you could have 50% attendance and still socially distance? There's not a lot of those, but we're trying to work through that metric and get all of that over there so they can chew it up and tell us what they think is safe. We have the advantage of looking at the guidance that was, for example, done by the Louisville professional soccer team. Now, when they played their game, they had a lot of people there, and they had reserved seating, which makes it even more difficult to socially distance. It's hard to sometimes think at first, but you can actually socially distance easier in bleachers than you can in reserved seats. So what can we do there? The mask requirement is a given without question. You're gonna be telling people that they're gonna come in, they got to wear a mask or a face covering of some type. So we're trying to get the competition documents. We've had to take this in small bites because we're also watching what you all are doing and watching how you're developing plans and what goes on in your plans. So I would encourage you, as you find time, to either have staff dive through these and help generate questions, or if you have questions, I want you to reach out. Like I said, you have 9 superintendents, I believe it is, tied in with our board right now. They are your peers. They're going through the same things you're going through, the same headaches you're going through, dealing with the same type boards that you deal with every day. So they are definitely a friendly group for you and the way they act. We will also, our plan is to, as soon as the document is released, and we are hopeful to get it before practice starts on the 24th, but we will have PowerPoint way of you presenting this to your staff. We'll have a presentation online. We'll also have written documents, and we'll try to spell out from public health the things that there's not options on and the things that there are options on. If I were planning in a district right now, I would have my facilities people looking at what is a reasonable capacity if we're going to keep people separated, socially distanced, which, as you all know, is basically 6 feet apart or 3 feet apart if I'm wearing masks. How many people can I put in there? And then I would certainly be looking at the restaurant guidance, which will likely be a little bit of a guide if you decide to have concession stands. I don't think there's any need in reinventing a lot of wheels. There's lots of things already out there that are industry standard. So we look forward to coming back in the future. I know you have a very tight schedule today. So unless there's anything comes up, Tony, we just wanted to give a brief update and tell you we will keep giving you information and keep trying to get you as many resources as we can as we all try to help reopen and give you opportunities to reopen what we think is the most valuable dropout prevention program you have, which is sports. We know right now, we've heard from enough people this summer, enough parents, hundreds of them. We know right now that if we decide just to bail and say no sports, period, we know what that's going to do to your enrollment. And I know that's not comfortable to hear, but we know people, we probably could line up people who are planning on going out of state if there's no sports. So we're trying to juggle the virus impact, the community impact, and the education impact. But we want you to know we're in the foxhole with you, and we're going to keep trying. So if there's anything else we need to bring up, Tony, please just send that. We'll be glad to add it to a recently published FAQ document. But I know you have a really tough, busy schedule the remainder of the day.
Okay. Thank you very much, Julian. We really appreciate you. As always, I know you always listen in to the webcasts and are always providing information when we request it. And if we have not already linked your KHSAA document questions, we will make sure that we will link that on our sorry, I can't speak all of a sudden, on our COVID-19 page as well. So
I'll be glad
let me
to get with you, Tony. And I'll also tell the superintendents, we just sent this out this morning, and talking to the governor's office last week, one of the things that they really reemphasized, and it's kind of like having my own words thrown back at me, but in your schools, coaches and athletes are the leaders, whether it's leaders of students or leaders of your faculty and staff. We are going to try to start more emphasis on the masking campaign, more emphasis on athletes as examples. And we have continued to expand our discussions with public health on where all masks and face coverings and athletics work together. So we want you to know that we're going to be partnering that. That's why we sent that notice. And we hope to feature some of your schools in the coming days as well. Thank you, Tony.
Thank you, Julian. I appreciate it. Let me just go over to the soapbox real quick and see if we have any questions related to KHSAA or sports. It does not look like we do at this time, but I know you're going to be with us for the next couple, at least until 4 o'clock. So, okay. So I guess just hang tight with us for a minute, and I'm going to toss it over to Dr. Foster. Kelly?
Hi, good afternoon. I will just take a couple minutes. Tony, are you going to put those slides up? Great,
Yes.
Thank you. So just a couple things to come. I was checking the calendar and some notes. Just so you know, the library guidance will be released next Monday, August the 10th, and we will highlight that on the superintendent's webcast on the 11th. Also, the guidance around class size will come out on the 10th, and we will highlight that on the webcast next Tuesday. But since that's a pressing issue, I'm going to talk a little bit about that in just a second. And then on August the 17th, there will be guidance released coming from behavioral health. We talked about it last week about the suicide training and how that can possibly be done virtually. So behavioral health is working on that right now, and that will be released to you guys on the 17th. So just some things to come down pretty shortly. So just wanted to talk a little bit about class size exemptions or waivers that have been discussed the last couple of weeks. And the formal document we are still working on and will come to you all next Monday. But just wanted to say two things to you. If you have a school, which most A1 schools are, that have a site-based decision-making council, and then that council needs to look at policies or procedures of the SBDM to see how they can adjust the class size. So the majority of our A1 schools do have site-based councils, and the only thing that you would need to do to change the KRS around class sizes is look at your council policy and make those adjustments in-house. You also need to check and see if your local Board of Education may have possibly adopted something over time around class sizes. But both of those you can adjust locally. If you have a school or a program that does not have a site base, then my email address is on this slide. If you need an exemption of some sort around class size for a school or a program that does not have an SBDM, send me an email and I will work with you. There is a form that we have internally that we can exempt a class size for a school without a site-based council or a program without a site-based council. And if you have any questions about either one of these, feel free to go ahead and reach out to me. But I didn't want you all to have to wait until that guidance document officially comes out next week. So let me just review one more time. If you have a school that has a site-based council, then you need to look at the policies that your site-based council has around class size. Also double check and make sure your local board doesn't have a policy around that. And then if you have a school that does not have a site base or a program that does not have a site base and you feel like that you're going to need a class size exemption or waiver, just reach out to me and I will walk you through that process. That's all I have, Tony.
I think with that, we can go back. That should conclude all of our topics that were on the agenda. So we can go back to our question and answer unless, Commissioner, you want to bring anything else up while I go back to the soapbox. Should only take a second. All right, I can tell you right now, we have a couple questions on CARES funding. So Robin, are you on?
Absolutely.
Great, you're going to be up first. Okay, so the FEMA webinar said that the CARES funds lose their federal status once they go to the governor's office. Do districts have to pay federal benefits to employees paid by CARES? And then there's more comments. I've got to give you some more context. They're referring to the payroll benefits match for employer when paying a federally funded employee. They're saying that the state pays the bulk of the KTRS and all of the health, et cetera. But federal grants had been used to pay for these benefits when that employee is paid by Title I, 21st century, CCLC, IDEA, B, et cetera. If the federal grants are no longer federal, when they get to the governor's office, can they expect the state to pay the employee benefits on behalf of the districts as they do for state and local funded districts or employees?
So let's back up for just a minute.
Okay.
On the CARES Act funding and the money that is coming to the Commonwealth, all the CARES Act money will be reimbursement based. So districts will be expending their dollars at their district for whatever purpose. They'll either be using their general funds or they'll be using CARES Act money. And there's a little bit of confusion because we're mingling CARES Act money and we're mingling that with FEMA. So FEMA is reimbursement based. When the CARES Act money comes in, you can utilize that. We've tried to be cautious with how we talk about that, especially when it relates to salaries. So you might be paying some temporary type actions and utilizing it that way. So the federal dollars, you're not, even though it's coming from CARES, you can utilize that. But as soon as you use that CARES Act money, then you cannot seek reimbursement from FEMA for that. So we're kind of mixing several questions from several pots of money into one question. I will say that during this webcast, I've also been receiving some email correspondence from the FEMA representatives, and they know that there's a little bit of confusion out there. So we are trying to work with them to come up with some very clear questions and answers. And that confusion is surrounding the federal payment of benefits. So that's one thing. Another thing is around the match requirements, because CARES, of course, has various pots of money across the Commonwealth. So ESSER and GEAR are not the only two CARES Act pots of money. And there's a little bit of confusion on that as it relates to permissible match. So we'll be working with the FEMA folks to try to put together clear questions and answers on these questions that we see bubbling up. Admittedly, there is some confusion out there, and we're trying to get that straightened out for each of you.
Robin, thank you, Robin. I appreciate that. So we have a question about gifted and talented. They said they need some guidance on identification of students for gifted and talented if starting school all virtually. How do we assess students? I believe we do have guidance on this, but was wondering if maybe somebody could help provide an answer for that.
Yes, hi Tony, this is Greta Hilton. We did actually recently release some guidance on exceptional learners, and so there's information in that guidance that can be found on the KDE COVID website. But if there are specific questions regarding the assessment and identification of students with gifted and talented service needs, then please reach out to Kathy Anderson here at the department. She is the current GT coordinator for Kentucky, and she'll be happy to answer student-specific questions.
Okay, thank you, Greta. Appreciate that. All right, Todd, I think you're going to be up next. They were wanting you to elaborate more on the what the emergency leave policy should say. And then the question right after that was any comment on the emergency leave order. This could put superintendents and boards in tough situations if there is too much flexibility. We have to staff in order to start school, and we are not able to get subs due to many being high-risk retired teachers. So I'm going to check both those off and mute myself.
Thanks, Tony. The emergency regulation that is being proposed to the State Board of Education is actually on the board's portal for you to review right now. It's open to the public for your review, and I would encourage you to go take a look at that. But essentially, it provides great flexibility to school districts, both their boards and their superintendents, to come up with action, policy, or procedure in order to implement the emergency leave, the additional emergency leave that is permissible for school districts to use, but is not required. The reason that specific language was added was based on our consultation with the Kentucky School Boards Association, and they requested, and we of course listened to that request and took their feedback and incorporated it into the draft. Because they wanted this to be very permissible based for school districts, not require it, and also provide great flexibility to school districts in how it could be implemented. And that was based on the guidance that the School Boards Association provided out to all of its member districts as a result of Senate Bill 177. So there is great flexibility in how districts will create those procedures for granting additional emergency leave related to COVID-19 if the school district chooses to do so. I know that the School Boards Association provided guidance out to its member districts as a result of Senate Bill 177, and I would encourage you to review that guidance that the School Boards Association provided and follow up with them once this emergency regulation goes into effect, because I believe that it was the intent of the School Boards Association to essentially provide the same guidance to its member school districts, and that would certainly be applicable and work, assuming that the state board adopts the regulation as it's proposed. And again, that is on the state board's portal for any superintendent to review right now.
And I can make
Yeah.
sure that we, just to follow up on that, I can make sure that we tweet on our KDE social media channels, a link for the portal, so you all can look for that information very easily, although it is available on our website under the Board of Education. Kevin, did you want to add something?
I don't want to create more fear and anxiety, but I think the person submitting the question is right to be cautious about and I believe the emergency leave should be utilized as much as possible when employees are affected, and that's what the policy should say in your district. But that's the district's ultimate decision. But the question is correct in that there may be issues with obtaining subs. Just today, there was stories out of Gwinnett County, Georgia, which is around Atlanta. It's a 180,000 person school district, but they had 260 employees that are in some type of quarantine after coming back, starting back to at least in service. And so while 260 may not be many employees out of a district that large, that's a sign that this is still very scary, and the virus is unpredictable, and so there are going to be challenges ahead, unfortunately, due with substitutes and other issues that the person asking the question outlined.
Okay, our next question is, I think it's going to go, I'm going to kick it back to Greta. There is, should in-person one-on-one special education evaluations resume? It's impossible to socially distance for these, as it requires students looking at test material the examiner manipulates, and also often requires over an hour together in this space.
Thanks, Tony. Again, this is going to be one of those situations in which local districts really need to consult with their local health departments to determine what's safe, what level of PPE is needed, and what's available. Where the safest environment could be for these types of evaluations. And if it's determined that it is not safe to conduct face-to-face evaluations, then again, we've had this conversation repeatedly on like other webcasts, and I think it's actually in our guidance as well. It's a time for the ARC team to come together to document what it can do safely at this time. Right now is a really good time to do a review of records for reevaluations, if that's an option. If it's not, then move forward and plan for the evaluation that the ARC can conduct, try to make the most informed decision. But at the end of the day, it's really about safety first, and then continuing to document, and ensure that parents are fully understanding and engaged and part of the ARC team.
All right, next. It's going to be a question. I think this might be for Kay Kennedy. What is the decision on carpeted surface, specifically classroom rugs? In primary classrooms, they can be especially helpful for students to know their boundaries.
So carpets provide yet another surface or another item that has to be cleaned. And certainly you can do it. If you go on the CDC website, there is a section devoted to cleaning soft surfaces. There are products available that will disinfect. And I think if you have a situation where you have children on a rug, sitting, crawling, doing whatever kids do in this time on the rug, that you should consider the necessary cleaning and sanitization that needs to take place. There's a list of products on the CDC website that could be helpful, but again, you have to be careful if this is a carpeted area that people are going to be coming in contact with, with bare hands or sitting on, as opposed to walking on a carpeted surface. I think you have to be very careful about the types of products that you use. So the easy solution is to not use area rugs or carpets There perhaps are other ways that you can mark boundaries on the floor by using colored tape or some other type of marking that would help with that boundary issue. But again, it is possible to address carpets, but you need to be very careful about the products you use and your ability to do that extra maintenance with the staff that you have.
All right, thank you, Kay. The next question is, will we learn soon if Governor Beshear is going to recommend closing school buildings? We will already be in professional development if he waits until August 17th.
I'm not sure if that's if they're saying when there will be a continuation, if there will be a continuation of no in-person classes, or if that's a different question as to actually closing buildings for anyone to utilize. You can utilize your school buildings now using Healthy at Work, even though we continue to encourage you to, have as many people as possible working remotely. But if assuming the question is one or both, as I stated earlier, the governor has stated, and Dr. Stack has stated, as Dr. White and others, that we're in this 2-week period. It's a little over 2 weeks to get to around August 15th to see if the numbers are decreasing or have hit a plateau. And we have some early signs, as the governor indicated yesterday, that may be occurring. And we'll obviously know day to day if that's a trend that we want to see that trend going down or plateauing. That will then inform the governor and public health about whether an additional recommendation needs to be made for further holding off on in-person classes, or if that can be lifted. The unfortunate thing about it is we want to see if that trend is there, so we don't go back too early. And seeing if the trend is there is going to take us very close to August 17th. It's the way I understand it. So you may not have a answer or guidance from us and from the governor's office on that until over a week from now. And that's due to the fact that we want to see these mitigation efforts starting to continue keeping these cases going down. And just anecdotally, I think we're all seeing more people wearing masks and less people congregating, et cetera. And so we're hopeful that will result in us being able to at least have the option to go back to in-person classes in mid to late August. But unfortunately, it's too early to tell.
Okay. All right, thank you. All right, I think this next one's for Dr. Foster. Do you know when we will receive an update on the 21st Century Learning Grants? Our families use this resource, and we need to know what is allowable.
If you applied for a 21st Century grant for the 2021 school year and received one of those grants, then you have already been notified that you were a recipient of the grant in mid-July. If you have any additional questions, please contact Bridget Stacy.
All right, thank you. The next question is looking for advice related to processing potential new employees as a result of COVID. Local police entities, in parentheses, city and state police, that normally perform fingerprinting are not currently performing that service.
I think this question came up several weeks ago. Todd, do you? And I believe there was a workaround, but I don't know don't remember the details.
I don't recall the workaround myself. Someone else on the call may recall that, but that's an excellent question that I'm happy to follow up on with state police and other entities.
I will mark that one. I can mark that one as a follow-up, and I believe we know who asked that question, so we can be sure to specifically follow up with that superintendent, but also provide that in our updated Q&A and also for next week as
Great.
well. Thanks, Todd. The next question Is there a possibility that a district might be forced to adopt a hybrid schedule, even though it has figured out how to go back in person 5 days a week, meeting all requirements? We are each unique.
Can you say
This is
that again?
This is
Go,
Kelly.
Kelly.
I think I can take it, Kevin.
Go.
If you right now, if you're planning on going back face to face and the numbers hold steady and that we're able to do that, I think that's great. I don't think there's going to be any part of forcing you to go to a hybrid schedule if you are planning on a full face to face. But we have asked since May that you have several different plans. That way, if something does happen and there's a recommendation coming from the governor's office that you have a hybrid model that would fit your district, ready to go if need be.
Okay. Foster, next question. So this is just a comment, and I think, Kevin, you had indicated you might be willing to kind of provide some support for this one, where superintendents say they're starting to feel like the quote unquote fall guys to our communities based on no firm directional action answers from the Department of Education or the governor, and it's not a good feeling.
Well, I can't change how you feel. And if you feel that way, I understand that that's not a good feeling. We have provided operational guidance and to you to make these decisions. My entire career with the education department, over 16 years, all of the K groups have outlined the positive features and why local control is so important. And so you are getting a directive from the state on things at a statewide level when we have that data that we can say on a statewide basis something needs to happen. That's when you got the recommendation from Governor Beshear. You've got many recommendations that you follow, but the most recent recommendation is that we not have in-person classes. It's not a mandate because it didn't have to be, because everybody cooperated, as I discussed earlier. Then we've given you guidance on how to build your own playbook to determine how you can best deliver instruction in your school district based on your demographics, based on your resources, based on the layout of your buildings, based on the absentee rates you anticipate in your teachers, based on your conversations with the local health department, based on the opinions of your local board and how they have directed you as their CEO to proceed, based upon your philosophy of education, based on all of those factors, which is why we have superintendents. You have all of those tools in your toolbox to be able to make those decisions and recommendations. And there will be criticism in the community, just like I get criticism here, and that's part of the job. You're going to get criticism in the community. You're not going to satisfy everyone. You don't satisfy everyone in a normal school year. And so we are not sitting here at the state level saying, well, let the superintendents take the fall for us. We are trying to provide you the best information, the best data that we can, the best guidance that we can, give you expectations at the state level that we know that will reduce the risk, give you recommendations, strong recommendations when needed, when we know a statewide solution, such as not going back to in-person classes until at least August 17th is necessary, and then honoring local control and those decisions that are best handled locally using all of those things I described, using all those 17 guidance documents. And Dr. Stack said it the best, and I have his quote here. He was asked a similar question several weeks ago, and I wrote it down, and he says, we're asking you to use, and he's talking superintendents and school leaders, use your educated judgment based on your knowledge of the community. There's 171 of those judgments based on 171 communities, and that is what's going to get us to solutions that are right for every child, or all of those playbooks that you all are going to have in action. It's going to look a little different in every school district.
Just a few more questions left. Let's see. Excluding FEMA, do districts have to consider federal benefits when using ESSER funds for newly created positions? Robin? Robin, are you still on?
I am. I'm sorry, I was having trouble unmuting. So I apologize. I think we're all having problems with that today. Remember that ESSER funds, CARES funds are reimbursement based. So it almost appears that the questions that we're receiving are treating those funds as they are the original source of payment. So use whatever funds that you're typically using, whether that's general funds or federal funds, whatever funds you're using to make those payments. And based upon your original source of funds, that's what you should follow as far as your fringe and everything else. Remember, your CARES Act funds are just reimbursing those amounts.
All right. Let's see. Another question. I'm trying to go make sure I've gotten all of these off of here. Isn't staying at home in a bubble practical for schools until a vaccine or treatments are developed, since teachers can teach remotely?
Well, I think practicality has to be balanced with services that we need to provide to kids that cannot be, and we learned this in the spring, while we did a good job in a crisis situation of delivering instruction the best we could, it is not perfect, and it won't be perfect this semester, and even though it's evolving. And so there are services that need to be one-on-one or that are best delivered in the school setting, not to mention all the other activities that are involved in just being in a school building together, the sense of community, etc. And so while being at home and staying there does have benefits with the virus, we also have to balance that with the needs of kids. And if we can do so by reducing risk and coming back to in-person classes, or gradually getting there, or having a hybrid solution, and we can reduce that risk through wearing masks. And when the positivity rate is going down, we're at the plateau, that's where you're going to get that state level guidance about whether or not the rates are where we can have a comfort level, and whether or not there can go back to in-person classes. I think that all has to be balanced. Kelly, do you have any further comments on that?
I know. I didn't know if Dr. Meserly, if she was still on, she might want to say something from the health aspect of it, since they referenced the vaccine.
Okay, can you all hear me now?
We can.
Okay, great. I wanted to, oh, I'm echoing, sorry about that. I wanted to echo what Commissioner Brown said, that it is really important that students still receive the services that schools provide for them. The American Academy of Pediatrics has actually warned that students will have mental health issues, behavioral health issues for a long term without school. So it's very important. And pediatricians do want students back in the building safely. There are important screenings to be done at school. Child abuse reports have gone down because children are not in school. So there are very important protective measures that schools provide. So if we can do it in a safe way using our evidence, I do believe that there are safe ways that students can go back to school. Thank you.
I think let's see. Will the ventilation questions be addressed in a guidance document or on the frequently asked questions?
I'm not sure if there are any specific outstanding ventilation questions other than it's a very complicated topic that I think, there are people that do this for a living as engineers about HVAC and building conditions. And so I think it's going to be a larger topic for discussion as we move forward. If there were outstanding individual questions about whether or not doors can be opened in lieu of the school safety guidance and all that, we can certainly answer those. But and I'm going to charge public health to continue working with KDE and KDE's facility folks, reaching out to their counterparts and finance cabinet and others, because this is an area that obviously needs additional thought, particularly if districts are going to be trying to have solutions to increase airflow. There may be, as we stated earlier, some unintended consequences we don't know about.
Okay. And since I just wanted to share with you, I want to go back and share my screen once again, because the FAQ sheet was brought up, and I did receive a text from a superintendent wanting to know where they can find the FAQ sheet. So can you let me know when you see my screen again?
We see it.
So again, you can go back. This is, I'm not going to take you all the way back to the beginning, but this is our KDE COVID-19 page. Back where I was talking about the reopening guidance, there's a couple of places where you can find the FAQ, but the place I always go is right here under important documents. I click right there, and it'll take you to this Google document. This is why we refer to it as the yellow sheet, just because it has yellow on it. I know it's very original, but as you can see, it's working. Hopefully it's pulling up so you can see it. The last edit was made 3 hours ago, and I can assure you there are over 500 questions in here. So there are currently 12 people in this right now. Looks like 16. And you can simply do a command or control find or something if you're looking on something in particular for something in particular. We do try to keep it updated based on when we update the document. And if there is a link that's useful, we do try to provide that for you as well. So this is where you can find the FAQs for the districts. I do need to change that at the top, but it has been updated as of today, which is August 4th. So I will go ahead and stop sharing. And with that, I think that we don't have any more questions.
Tony, correct me if I'm wrong, on the Q&A sheet, we do continually edit that as far as, for example, maybe questions that were appropriate and asked and answered back in March are taken off if they're no longer relevant. Is that correct?
Yeah, that is correct. We have been using this sheet since March. So internally we refer to it as a green sheet, and then we will take off the questions. There was questions in there about graduations. We have the master document that we have taken, so that the questions that are no longer relevant, they're no longer visible, so that you're not reading questions that are no longer relevant. But we do try to, we have a staff person, several staff people, that this is part of their daily job responsibilities to keep this updated so that our districts can regularly check this. Not just superintendents, but district staff and teachers and parents and community members. That's why we do it, and it's there for your review. And there is also questions from the not the task force meeting, the town hall from a couple of weeks ago as well, that many of your teachers participated in.
All right. Thank you, everyone. Thank you for the questions and for the discussion. I know that there's a lot of anxiety out there, and I want to thank all of you for what you are doing. We're going to continue to have these webcasts. I think we have a lot to be thankful for in this state because of the work that has already gone on and what you're doing there at the local level. And we know we already have a commissioner of education that is not even required to start doing things for Kentucky, and he's already engaged and present. And that's something that I'm excited about, but it means great things for the kids and school districts across the state. So when you have that anxiety, know that it's normal. Know that your neighbor across in the other district is having probably anxiety as well, continue the conversation and feel free to contact us. We will see you back here next week at the same time. And then we also have the Education Task Force on Monday afternoon at 1 o'clock. Anything else to announce, Tony?
No, I just wanted to once again thank First Lady Brittany Bashir for joining us today and for the Coverings for Kids initiative. I do think that this will help your districts out tremendously. I know that there are some, particularly, I know Trigg County, when I was visiting a couple of weeks ago when I was out at Lake Barkley for my anniversary, that we had seen that they were trying to get some masks. And so I certainly hope that you all are able to utilize this initiative in a way that will help in a way that you best see fit. And so I just hit the send button. So you should be getting the email with everything that was promised to you in your inboxes right now. And if you have any questions, there's also information on how you can ask those questions. And then, of course, you can tune into the governor's press conference, which will start here in about 3 minutes.
Everyone have a great rest of the afternoon, great rest of the week. Thank you.